Hi, my name is Carolyn. I am from Pass Health Foods, an independent health food store in Palos Heights. So today I wanted to talk about vitamin D. Vitamin D has been in the news lately. It's so great for the immune system. Um, it's often called the sunshine vitamin, and that's because our bodies make vitamin D when our skin is exposed to the sun. But even in optimum sunny conditions, like the warm summer sun, sleeveless shirts, still that production often doesn't work as well as we would like. Sunscreen inhibits, our body from making that vitamin D as well as it could. Also, northern latitudes, things like that. But especially as we get into fall and winter, it's especially important to consider supplementing with some vitamin D since we're outside much less and really only our faces and hands are often exposed. So vitamin D is important for all sorts of different processes in the body, from cardiovascular health to helping with mood. It's really important for bone health and in children, bone and teeth formation, having those grow properly. But also, it's really wonderful for the immune system and important for proper immune functioning. If we're deficient in vitamin D, which is actually quite common in the United States, it's been estimated that over 40% of Americans are deficient in vitamin D. And that amount goes up in certain populations, like older populations, people in nursing homes. It's estimated that over 60% of people in nursing homes are vitamin D deficient. And it really does impact our immune system being able to function properly, which can make us more susceptible to colds, flu, respiratory viruses. But especially with what we're dealing with now with COVID, there's been quite a few studies come out just recently showing that people who were deficient, who had low blood levels of vitamin D, were much more likely to have more severe complications if they did get coronavirus, and even higher amounts of mortality from people who had been infected with COVID. So it's an important thing to take, and it's a simple thing. Vitamin D is inexpensive. It's a tiny pill. Like these are the ones I take, but they're just a teeny tiny little soft gel. So vitamin D is fat soluble, which means it does stay in the body. And it's something that is best absorbed if you have a little bit of food in your stomach. It's not going to hurt you without it, but you will absorb it better if you have a meal with some fats in it, just so your body can use it. Usually, people look for about 2,000 IUs a day to take. That's what natural physician Dr. Weil has always recommended, and that's kind of what we've gone along with. So that just for general health, about 2,000 IUs a day is a good idea. If you've had a blood test and have found that you are low in vitamin D, which in your yearly blood test and your blood work, with your physician, it's a good idea to ask for a vitamin D test. Sometimes doctors don't write that down on the regular panel, but it is a good idea just to see where you're at. So if you are low in vitamin D after a blood test, a doctor will often prescribe a prescription for 50,000 IUs of vitamin D, and you'd get that from the pharmacy. And it's meant to be taken as once a week. The trouble with those prescriptions is that it's D2, which is the synthetic form of vitamin D, and often your body does not absorb it as well as D3, which is what's the recommended best absorbing form. So D3 is usually from fish oil, but more recently from lanolin is usually what it's sourced from. There are some vegan forms of D3 if that's a concern. We have some by a company called Garden of Life, but we do have lanolin-based D3 in vegetarian capsules, depending on how you feel about that. But it is an important supplement, and it's a great thing to take. It's inexpensive. Like this is one we have at the store. It's a 2-pack, so it's 240 capsules. That's going to last you like 8 months. for $13.99, and that's the 2000 IU size. So that's usually what we'd recommend, but I would definitely think of starting to take it, only because deficiency is so common. And not just the immune system, but it's really important for bones. It can help with mood, people who are deficient. There's so many side effects, I would say, of people who don't have enough vitamin D in their body, because it's needed for so many different things. So by boosting those levels, it can really make a difference. So stop by the store. We're in Palos Heights, again, Pass Health Foods, and our address is 7228 West College Drive in Palos Heights. But it's a fantastic supplement, easy to swallow, tiny little pill, and it's inexpensive. So just especially with the research coming out having to do with coronavirus and the difference that having enough vitamin D makes in those diagnoses, and just what happens if you do get sick. So I definitely recommend giving it a try. So have a great day, stay safe, stay healthy, and be well. Thanks.